how to insert a urinary catheter on a female. So first you'd come in and introduce yourself to the patient and explain what you were about to do, ask them if they had any questions, and educate them if they did. And then you would provide for privacy, so I'd pull the curtain, shut the door, make sure that nobody else can see her. And then I'm going to gather up my supplies. So I've got my cath kit here. And since we're going to be putting a drape under the patient's buttocks, I'm going to put gloves on. Just clean gloves, not sterile gloves. Okay. So we've got my 1-inch margin that I can touch on the sterile field. I don't want to touch anything else. Not yet. And then I can touch the glossy side of this. So I would take the blankets off the patient. And only touch the glossy side. Not to contaminate the sterile field. Okay. Now, since the rest of the procedure will be sterile, I'm going to put my sterile gloves on. And before I started, before I put the sterile gloves on, I'd wash my hands and check the armband when I went into the room to make sure it's the right patient. Okay. Put my first glove on my non-dominant hand. And I can touch the cuff, but nothing else. And then this one, since this glove is sterile, I'm going to put my hand in the cuff just to create kind of a security. Okay, now I've got my sterile gloves on. So I would drape the patient just for extra privacy, because when you're dealing with the perineum, it can kind of be embarrassing. And then I'm going to set up my supplies. Okay, so first I would put my iodine, saturate the cotton with iodine. And then go ahead and attach the syringe to the catheter so that it's all ready to go. Okay. And then next I'm going to clean the perineal area. So I'm going to take one of these, and with my non-dominant hand I would spread the labia. I would clean the side farthest from me first, and then dispose of it, and then the side closest to me, and then down the middle. Okay. Now that's clean. And then we have lube in our kit, but we can't use them on the mannequins, so we're just going to pretend like that was sterile. So I would lube the end of the catheter that will go into the patient. Okay, so now I'm ready to put the catheter in, and I would not have touched that with my hand because that hand would have been dirty from touching the labia. So I would instruct the patient to take a deep breath as I insert, and then you insert it into the top hole, into the urethra, until you meet resistance, and then, or until you see urine going in the tube. So then you want to blow up the balloon so it will stay in place. And you've got to detach the syringe, or else it'll just fill back up and the balloon will deflate. And you want to pull gently to make sure it's in place and it's not going to fall. And then I would attach the urinary catheter bag onto the patient's bed, always below the bladder. You don't want the bag to be at bladder level or above it, because the bladder could go back in. And before I put the balloon on, if the doctor had ordered any lab tests or anything, I would have pulled a specimen from the port. And as the urine is coming down into the bag, I would assess the color, the amount, if there's any sediments or anything inside of it. And then I'm going to attach the catheter to the patient's leg. So I don't want it too tight, because then you have a chance of it pulling out. It's looking right about there. And then I've disposed of all of my supplies. Actually, I'll retape the catheter so it'll stay on. Don't want to put too much tape on the patient's skin, because you don't want to risk tearing skin when you take it off. So I should have made sure it was on tighter. Okay. And then I'll put the patient's blankets back on so that they can have privacy. And then, oh, actually first, before I did that, I would have wipes or a washcloth or something close by so that I could cleanse the patient of the iodine, because you don't want that left on to get up into the urinary tract. So I would just make sure that all of the iodine was off the perineal area first. And then before I left the patient's room, I would check to make sure if they were in any pain or if they needed anything before I left. And then document what I found out about the urine. And after I threw away all my supplies, I'd wash my hands.